We're at the IAS meeting in Paris. We're here with Anton, who's got a story to tell and is doing good work. And you just got finished with a presentation and a panel. And I'd like, first of all, to tell us about your background and so forth, how you got into this in the first place.
So first of all, my background is good family, good school, but as many teenagers, first experiments with substance and drugs took me to the systematic drug use and all the issues and problems come with drug use, especially because I started to use injecting opioids, which is kind of really hard drug. So I lost my links with the family, with the friends. For some period of time, I could represent myself as a kind of ordinary street junkie, but and I tried to quit from drugs at least 50 times, different rehabilitation centers, detoxification, but nothing worked. Nothing worked besides harm reduction program and opioid substitution therapy. And because of so positive and powerful changes came with OST, opioid substitution therapy, I began to share these information with my friends, these ideas. So and finally I started as a peer consultant in one of the local grassroots NGOs, just even as a volunteer, just to share my success story with my peers, with other drug users. So that was the beginning of my professional way in so-called HIV service. Then we united to Association of Substitution Therapy Advocates of Ukraine. That was a national organization uniting activists from drug users community and substitution therapy patients from around the country. But I always want to do more and more, and finally I joined the Alliance for Public Health, which is formerly known as International HIV/AIDS Alliance in Ukraine. This is one of the leading NGOs in Ukraine providing the prevention and harm reduction services for key populations, not only people who inject drugs, but also sex workers, men having sex with men, and transgenders and other vulnerable groups. Because in Ukraine, as well as the other countries of the Eastern European Central Asian region, we have a concentrated epidemics. Mostly it's injection drug use, but not only, but anyway it's key populations and these groups. So with Alliance for Public Health, I coordinated national and then international harm reduction programs, sharing my personal and professional experience with the thousands of people with the same drug users, but trying to develop and to make communities stronger. In our advocacy, we created the Eurasian network of people who use drugs, and now Ukrainian network of people who use drugs. So that's very briefly who I am, and I'm from Kiev. If it's important, from Ukraine, so I'm native Ukrainian, and I have a master's degree in international economy, if it makes sense.
Right. But you now have a real mission.
Yeah.
Focused and actually professional, so to speak. And have you met people like Michelle Kaczynski?
Oh yeah, we're good friends with Michelle.
I would imagine, yeah.
Yeah.
I was gonna say. This, I try to get to talk to him, but it's not that there's anything wrong with talking with him, but you are the person that's the most important. It's about you. It should be, the discussion should be with you. And so I think that the messages that you can create are genuine and really important for the community to hear. So I'm glad that we're here. But you must have specific issues that are challenging. And with what you can say here in this forum, can you relate to some of those things that you're trying to change and improve in your community, in your country?
First of all, let's divide the communities issues and country issues as issues including governmental things or something, because what we are facing with as a community, it's of course first of all stigma and discrimination among people, and it seems like it never stops. So we are trying to change the attitude of people, but it's permanent process. We are facing with legal barriers because Ukraine is one of the former Soviet Union republics, so we have the whole heritage of repressive approaches, not only in law enforcement, but also among even the medical understanding of what is drug use and how to struggle with this. So we are facing with lack of funding and support of community-based organizations. So that's the basic things for communities. Of course, access to services and treatment. Now it's more or less accessible, but the important note is that now it is funded by international donor organizations. So, for example, talking about harm reduction services or opioid substitution therapy, it's international donor support. So governments still promising that we will support at least some part, but finally what we have, it's only the first time they procured some amount of substitution therapy medication, but that's it. That's only one of the components of the whole wider circle of the treatment of the needs. Yes, so talking about this conference, which is more scientific, and I understand that medical community is the main audience here. I want to remind them that medical community was on the first line of the advocacy of access for specific services and treatment for key populations. So don't forget your mission to help people, and there is no difference whether it's general population or person who inject drugs or a person with other specific needs or diseases. I also having this opportunity, I don't know who will see or hear my interview, but I also want to call for support from the government because now we are under the reforms, health reform, penitentiary system reform, and so on and so on. But it's still goes very slowly, and there is no guarantee that the services and treatment will saved on the same level as we have, for example, with Global Fund support, which started the transition from my country and the other countries of the region.
So the countries that you're involved with that are in need and similar need, I'm sure people like Michel Kazaskin has got great ideas, and hopefully he can make some connections that are important. But have you ever thought about doing some demonstration projects where you can actually demonstrate the financial and human benefits, both human and financial benefits, of a program that really is robustly inclusive to take care of all the needs of the people who are affected?
We had kind of particular research, for example, to advocate for improvement and expansion of opioid substitution therapy. We made a research of influence for criminal activities of people who inject drugs and kind of criminal situation in country. So we received particular evidence that these programs is effective. But any research has cost money. So we are ready for any demonstration programs. I mean, we as a community, we as NGO, we are ready for any demonstration projects. We have human resources, we have expertise, but what we need is funding for such kind of researches, because research is also not cheap intervention. So.
But the challenge, I guess, would be that if you could set up some sort of a demonstration project and it was successful, would you show that to the would you anticipate showing that to the government and then expect them to support?
Yeah.
That would be the challenge.
Yeah, the thing is that even having this evidence from this demonstration program, it does not automatically means the government support, because the main thing is around political will. And given the fact of huge geopolitical influence of Russian Federation in the region, also the understanding of decision makers in country, I mean on the top level of the government, HIV or people who inject drugs are still not priority for them. So they think that, or they announcing that priority are children or aged people, and still continue wasting money for repressive drug policy or ineffective policies.
Because it seems like it's a huge ethics.
So it's complex. It's complex. Right. It's not just to provide the demonstration program. So it's a complex of reasons and complex of factors which should be addressed.
Because the incidences, as we mentioned before we went on camera, is huge in comparison to other countries where there is an effort.
Yeah.
And where there's no effort, we see what happens. And this is something I think somehow or another we're going to have the will to address the political will in your country with big organizations who can take care of some of the funding for the needs to be met.
Yeah, that's what we're trying to do.
Yeah, but the future is there. I mean, they can either have a future with a country with with less people with HIV, or an expanding population of people living with HIV, and it just seems like there's, in my mind, no chance to pick the right choice. So, what is your future? What is your plans to continue? I know it's frustrating for you, but to deal with this, but thankfully you must be among friends here at this conference. But when you go back home, you're there amongst the in the weeds, so to speak.
No, I have good expectations, because if we see back for the 5 or 10 years, anyway, we see the positive dynamics. So maybe things are changing slowly, smoothly, but anyway, they are changing and changing positively. So just for the future, we need just a concrete plan what we need to do, because we hear a lot of things about global targets, 1990, ending AIDS to 0, and sustainable development goals of UN, and all member states, including my country, signing the declarations and kind of showing their commitment. But in the reality, they are not so active, or sometimes even absolutely passive to these things. And this is the role of communities and NGOs every day to remind them about their commitment and their obligations for the citizens of this country, for those who elected them, and for everybody. So I'm an optimist.
Good. I think you need to be in this situation. But it's really great to visit with you, because I think you're a shining star amongst in the big broad sky. But it's just, there'll be more of you. And I think if you can tell your story and get others to sign on to in theory, to what your planning and your thinking is, more will be like you and go out there and pitch the good message that will eventually, enough of you will be able to make a difference. Sometimes one person is not able to do it, but multiple people, especially with leadership of people like Michel Kazaskin, it's going to be a good thing. I couldn't think of anybody better to do the work over there than him, and yourself, people like yourself. So.
Absolutely agree. Michel is really powerful ally of communities, and in our region, his voice is really powerful and always needed for us.
Thank you very much, Anton.
Thank
Appreciate
you.
it.
Thank you.